All right, welcome again. This is a really unique feature that we just booked for you. I want to show you some unique tibial access in less than 5 minutes. Here I want to share with you a few cases. The first case that you're looking at right now is a complex calcified tibial artery that we're trying to get into. What's unique here, you can see the artery has a circumferential medial calcification, and you can see the ultrasound actually localizing the artery, and then we got the wire through that in a cross-sectional view, and then as you can see we advanced it over long axis. This second case here, you can see the artery actually collapsing with a compression, indicating that this artery is chronically occluded, does not have a lot of pressure. Notice how much we're struggling with that versus the first one. And the reason we're struggling with it, because it has no pressure. Basically, it's collapsing with the vein. So my advice to you when you see something like this is to actually do a Sullivan's technique. You just go through and through, and then when you go through and through, like we just did right here, then you ask your assistant to go long axis, and then what you do then is you just pull the needle back. As you can see here, the thumb contracting slowly back, and then the posterior wall is coming back with it. And as that comes back with it, then you just kind of keep trying to advance the wire, and boom, here you go. The wire just went right through, as you can see here. So that is a very unique trick. I wanted to show you that, so please take a look at it again in your own time. This next case here, you have two large tibial veins on each side of an tibial artery. And this is being done in the medial approach. Sometimes you can't actually bend the knee. Notice how, to get access in here, we had to actually sort of go along with the hockey stick probe. I wanted to show you this one because it's complex and we had to do it this way. So we're able to get access in the sort of medial approach, and you notice that the ultrasound tech never moved, and we were able to get in and advance the wire. This next one here, notice the needle is being moved back and forth, and the reason that is being done is actually trying to stick the wall, truly is, the wall or the adventitia of the calcified artery that you can see here, and by grabbing it actually, then advance the needle into it. So we just did, we grabbed it in a cross-sectional view and went through and through. And what you're seeing right here, right now, is you're seeing the anterior and posterior medial wall calcification. And what we're doing here is we actually pull them back and slowly advancing the wire. And here you go, you can see the wire just went right through. So I want you to see that because I don't want you to be at a disadvantage or be discouraged when you see something like that in the future. The next one here is again another heavily calcified tibial artery. Notice the severe anterior wall calcification and consistent with also a posterior wall calcification. Imagine, you can see here how much did the artery go down with the needle until we be able to finally pop right through it. Notice we popped right through it into the posterior vein that is under it. So when we advance the wire has gone into the vein a couple times. That's okay. So you just continue to contract back. As you can see here, you just pull back the needle slowly and you keep trying with the wire. And even though the wire keeps going into the vein, you just keep going back and try. And finally what's going to happen is that posterior wall of the artery is going to drop, and then your wire is going to advance like you just saw right here. Again, I'm so glad I was able to share this with you. These are excellent tips and tricks for tibial access of the ultrasound. And the last one was an excellent example where the wire is almost the size of the lumen of the artery. So nothing is impossible. If you have any questions, don't feel free to reach us at CLI Global. We are here to bring you the latest tips and tricks in CLI therapy and access. Stay tuned and we look forward to hearing from you.